Hi, my name is Aiden Risk, and I'll be giving some background on what welfare is, the issues surrounding it, and how this week's article by Deseret News sheds light on ways our system might be improved. So to start, what exactly is welfare? In the U.S., welfare refers to a variety of government programs designed to help people meet their basic needs when they're struggling, whether it's due to poverty, job loss, illness, or other challenges. Some of the most well-known welfare programs include SNAP, which helps the people buy groceries. Medicaid, or Medicare is another one, which helps people cover their medical costs. TANF, or TANF, or temporary assistance for needy families, helps people with their unemployment benefits. And the goal, like our basic line for these programs, is to create a safety net, or a way to make sure that no matter what someone's situation is, they're not completely left behind. But as with anything involving government systems and large budgets, welfare is a complex topic. There are a lot of opinions on how it works, what actually does help, and whether it needs to change. That makes welfare one of the country's biggest current challenges. Even though welfare programs are meant to help people, the way they're currently set up can create a lot of problems. One major issue is how disconnected and how complicated the system is. The system itself is hard to navigate. If people need help, they often have to deal with multiple government agencies that each have their own rules, paperwork, and waiting periods. They might have to visit different buildings as well, talk to multiple workers, and repeat that same information over and over again by filling out separate and frankly confusing applications. That can be frustrating and discouraging for people, especially if they're already stressed out or dealing with their own financial issues. This can be overwhelming and especially annoying when they already know that they qualify for welfare, but the operation itself and the way it's set up is holding them back from obtaining it. Because agencies are separated, they don't always talk to each other. This means that the government actually spends more money than it needs to, and that's just to keep the system running. That kind of creates a duplication of services, more paperwork and more staff or overhead needed for the separate systems as well. Meanwhile, the people that actually need the system are the people stuck in the middle, are navigating a maze just to access basic support. Imagine being a parent in crisis and having to figure out where to go for food assistance, or who to call for healthcare coverage, and what offices handle child care help. That can create a problem. And if you're someone who doesn't even speak English well, or don't have reliable internet access or transportation, the process can become even harder. Digital inequality is a real thing and a real issue, as many systems have moved online. There's a problem since not everyone has a smartphone or a computer or access to fast internet. This creates a gap for people and people who actually need the help. There is also a stigma with the welfare and attached to it. Some people are embarrassed to ask for help, even if they need it. People who apply for welfare sometimes feel judged or looked down upon, whether it's from society or even the staff that the agencies go to. That stigma can make people feel ashamed just to ask for help. And it kind of, is opposite to what the programs are actually wanting for, and what we're even paying for through our taxes. Some critics argue that certain programs might unintentionally discourage work or self-reliance as well. And at the same time, there's a constant political debate over how much money these programs should get and how much oversight they actually need. It also raises many difficult questions on regulating this sort of system. How do you know if the support you give is too much or if it's too little? That brings us to the article by Deseret News titled Perspective. America needs one-stop shops for benefits like Welfare Square. The article starts by pointing out a big problem in how we currently deliver welfare in the United States. It's currently extremely fragmented. For example, if someone needs food assistance, housing, or health coverage, they often have to deal with 3 different offices or websites. The article argues that instead of making people bounce between different agencies, we should argue what it calls benefit depots, which are places where people can go to access multiple services in one location, and these could help. They highlight an example called Welfare Square in Salt Lake City, which is run by the Church of Jesus Christ of Latter-day Saints. It is a building where people can get food or help finding a job, clothing, or even medical care, all in one location. It's designed to be more efficient and respectful on the people who come for help without people feeling the need to change locations. The article argues that this model, or everything under one roof, should be more widely used across the country. The idea of benefit depots would act as a centralized hub for government programs and help people not have to choose different buildings or call different numbers for SNAP, childcare, or Medicare support. To that same idea, in more rural/local towns and cities, benefit buses, which are mobile units equipped with staff and technology that travel to underserved areas, are basically mobile versions of depots that could visit rural areas or communities that don't have access to these services. An important comparison between Deseret News is the system that is implemented in Canada, and how the Service Canada centers are similar to ones that potentially could be integrated into our country. This shows that even other nations outside of our country have created government-run buildings that do provide multiple federal services in one place. Canada isn't perfect, but the model is more unified than ours is, and we could benefit from doing something similar. The point is that the system could work if it was better designed and with people in mind, and if it was simple, supportive, and easy to navigate. If you watch the news, you'll often hear the question, does welfare help or hurt America? At the core of its making, where welfare has always been intended to be helpful, but many criticize the ways it's actually implemented and the effects that those implementations cause Americans to act. The basic essence is that welfare does affect real lives. Whether it's a single mom trying to get food on the table, an elderly person trying to get affordable health care, or someone who just lost their job, these programs are often the difference between stability and crisis. On a larger scale, the way our country handles welfare reflects our values and how we treat our most vulnerable citizens and how we use public resources. For many, it's hard to label what is the role of the government and what should be the role of the government in supporting its people, and also raises the question on how do we balance the support with concerns about cost, efficiency, and independence. Some people believe welfare is essential to reducing inequality and giving everyone a fair shot. Others think it encourages government dependency and puts too much strain on taxpayers. The article we looked at doesn't take a strong political stance either way. I'm in huge favor, and I'm sure many are, is that when we look at the welfare system, we should ask questions more aligned with the statements like, what can we do to make the system more efficient, more human, and more effective? That's the basic essence of what this article is trying to convey. So, let's get two arguing perspectives to broaden our understanding and stance in the topic. Our debaters, Carly Seitz and Taylor Vaughn, will argue about if welfare policies are actually beneficial in reducing poverty and crime, with arguments based on the idea that when people have their basic needs met like food, housing, and support, they're less likely to turn to illegal activity out of desperation. We'll see if this is actually true and if the Affordable Care Act makes society healthier overall. I've been Aiden Risk, and I hope you like my part of the presentation. Thank you.
Hi everyone, I'm Carly Seitz, and for this week's video, I will be taking the position that welfare is helpful. In preparation for this week's debate, I listened to a podcast about welfare from Civics 101. The episode featured Professor Pramila Natarajan from Barnard College, who shared that welfare is a way for us to provide economic security to provide a safety net for the most vulnerable citizens in the United States. She also talks about how the national welfare system that we think about today started in the 1930s as part of the response to the Great Depression. Welfare started as a set of programs to provide money and other types of help to single mothers who didn't have a male head of household. Today, what we collectively call welfare is a program known as TANF, or Temporary Aid to Needy Families. The podcast goes on to talk about how welfare became controversial in the 1960s because of racial stereotypes. These programs, which were created to provide a safety net for women, particularly for mothers, became tied to issues related to race and questions about fraud and who is worthy to receive welfare. I found it very interesting to learn that from the 1930s to the 1960s, there was broad support for these welfare programs, but when welfare was connected to race in the 1960s, it became controversial. I wanted to share this background because I think it shows that there is a lot of support for the goals of welfare programs, but these programs became controversial because of the connection to race and the question of whether minority individuals deserve welfare. One thing I learned in my sociology class this semester is that a common myth in the United States is that most of the people experiencing poverty are minorities, but this is not the case. The largest racial group of those below the poverty line in the U.S. are white Americans, who make up 45% of those below the poverty line. I don't think most people are aware that this is the case. Let's now turn to my argument. I am arguing for the position welfare is helpful for our society, and I will focus on two main points here. 1. Welfare policies are good because they reduce poverty, and 2. Welfare programs help to create a healthier society and are thus an investment in our own future. The first point that I would like to make is that welfare policies are good because by reducing poverty, you reduce the negative consequences of poverty in our society. For my sociology course, I also learned that poverty is related to many things that are not good for a society. There is a link between poverty and crime, lower education, and even poor health. If we think of welfare as a safety net for those families that are living in poverty, then we are also helping out our society because we can contribute to reducing crime and having a more educated and a healthier society. These are all good for society as a whole and may even be saving our country money by investing in these programs as opposed to spending more money on jails or emergency medical care. If people get better educations, they are also able to contribute more to society in the long run. For these reasons, I think welfare programs are helpful for our society. The second main point that I am arguing is that welfare programs, if we think more broadly and include health care, like the Affordable Care Act, means that more people have access to preventative care and therefore won't have to rely on more expensive emergency care after they are already sick. As I mentioned earlier, there is a link with poverty and poor health, and this is often because these individuals are less likely to seek medical care when they first experience symptoms or have annual checkups. But these early interventions are often much cheaper than dealing with the health issues once it is a crisis situation. Think about going to the dentist. It's much cheaper to get regular cleanings than it is to get a root canal. But if you can't afford the regular dental visits, you're going to probably end up having a much more expensive procedure. This is true for most health conditions. I think welfare programs that include healthcare and even dental care are important because better access to these types of services means less costly treatment are accessible to poor people, so they will be less likely to hold out for emergency care. Thanks for listening, and now I'll turn over to my debate partner to discuss the alternative position.
Hello, I'm Taylor. I will be arguing against America Needs one-stop shops for benefits like Welfare Square. Welfare policies are often praised for their role in addressing poverty and improving access to health care. And while I think that they can be helpful, overall I think ideas such as one-stop shops to tackle poverty are more harmful than helpful. The first topic I'll discuss is welfare policies are helpful because by reducing poverty, they also reduce crime in return. I don't think this is the case always. While I do believe that reducing poverty through welfare programs can lower crime rates, there are other major factors that affect crime rate besides poverty. Crime is more complex than simply saying it is a consequence of economic hardship. Crime is influenced by a variety of social, physiological, and environmental factors, and not just poverty. These factors can include mental health issues, substance abuse, lack of education, and family dysfunction. For example, someone living in poverty may commit a crime not solely because of financial need, but due to personal struggles, a lack of proper social support, or criminal behavior learned from their environment. Welfare programs are designed to provide immediate financial assistance, healthcare, or housing support to individuals in need, but they do not necessarily address the long-term causes of poverty or criminal behavior. Welfare policies, while helpful in reducing some aspects of poverty, do not address these deeper, often more personal issues that can lead to criminal activity. While welfare programs like the Affordable Care Act are intended to increase access to health care and improve overall societal health, these programs may not be as effective as is hoped. While more people may technically have access to health care, the affordability and quality of health care may not necessarily improve in the ways that are promised. One of the most common issues of the Affordable Health Care Act is that while it expanded coverage to millions of uninsured Americans, it did little to address the underlying problem of rising healthcare costs. This leads to various issues, one being even people who may have insurance will still struggle to afford proper health care that they need, inevitably leading to financial issues and bad health. In conclusion, while welfare programs like the Affordable Care Act have expanded access to health care for millions of people, they do not necessarily lead to a healthier society overall or a decrease in overall crime rates. Issues such as rising healthcare costs, limited access to high-quality care, and persistent health inequalities suggest that simply increasing access to insurance does not guarantee better health outcomes. To truly improve public health, addressing both the social factors of health and the inefficiencies in the healthcare system is needed.